Code story to the stage. Code story to the stage.
So in my corner of nursing, we have what are lovingly known as those families. These are the families who, from the minute they walk onto our unit, we know are going to make us work just that much harder for our paychecks. Those families arrive on the oncology unit having memorized the entire cancer section of WebMD. These are the families who refuse to wear isolation gowns even though their child has a very obvious and very contagious infection because their cousin is a naturopathic underwater basket weaving instructor with no background in cancer, but that's beside the point. And she insists that that horrendous rash is really just toxins harmlessly leaving the body. These are the families who fire nurses, who decide that these nurses would never take care of their child again, not because those nurses were rude or unsafe or unprofessional, but because their personalities didn't exactly mesh with that of a mostly sleeping 3-month-old infant. So I go into a room to draw labs late one night, and thankfully I don't have to actually poke the kid because most oncology patients have more permanent IVs. You can check blood without using a needle. And I'm weaseling my way in between the mom and baby without waking the baby or looking fresh with the mom because they want to co-sleep just like they do at home. I mean exactly how they do at home. So they're on a mat, on the floor, with the thermostat set to Brazilian rainforest. So I'm down on my hands and knees, chasing after this kid with a little syringe. And she's small, right? So she's rolling back and forth, and I'm just praying that I don't drop it, because if I do, not only is the syringe not sterile, but when the lab results come back, we'll have no way to know if the potassium is the potassium level of the patient or the potassium level of the floor. And as it is, it's probably going to come back with my sodium level because I am sweating like a whore in church in this godforsaken isolation gown. But I get it. I get the sample, and I'm walking out the door, and right as I turn the knob, the mom's eyes pop open, and they glare at me. And she tells me to please not do that so loudly because it's messing with the baby's REM cycle. I try to empathize with these families, I really do. But it's tough because in my heart of hearts, I kind of just think they're doing it wrong. At this point in my history, my mom is going for treatment for stage 4 breast cancer. And I've been to lots of her appointments, and not once have I fired a nurse because I didn't like the look of her, or demand to see hospital policy before I agreed not to bring my mom sushi when she's getting chemotherapy. And my family is stressed too. We understand that these people are just trying to help her and do their jobs. I mean, I help as much as I can on my days off, and on my days on, I am giving those families much more holistic and knowledgeable care than they probably even realize they're receiving. It's because I'm knowledgeable, I tell myself several years later, that I still think my mom has a bottomless pit of options when her 5th go-to chemo stops working. I have a bachelor's of science in nursing and a BA from the University of Washington. I've done research. I've administered experimental treatments. I'm not just another daughter of another patient insisting that she knows better than a care team what the next step should be for my mom. And so I press my dad and I press her doctors to find the latest protocols or alternatives, even though my mom has said that she doesn't want them, because I'm so sure that I'm going to find the answer. I mean, I've seen multiple, many of those families leave the hospital with their kids healthy, thanks to treatments that didn't even exist when they started therapy. When my mom's surgeon brings her out from her latest procedure and announces with tears in his eyes that he doesn't think her liver is going to last a week, it takes all the self-control I have not to rip him at least 2 new assholes. I mean, he's saying this within earshot of my mom, the woman who survived multiple last Christmases only to go on to have amazing springs. I mean, does he really think the best thing for her to hear as she's coming out of sedation is that her organs are going to fail, when we both know that there's no way he can tell that with any degree of scientific certainty? So I stomp home, and I proceed to make the mother of all medication schedules. I mean, Mom's refusing most of these medications right now, but if she does decide to take them, imagine what could happen if she takes more than one. For a written thing, this schedule is a sight to behold. I've organized every med, by what it is for and when my mom can get it next. So that way, if I'm not there when she needs something, any one of the number of relatives who has come to help us will know right away what to do. Awesome. So I go for a walk. I'm out of the house maybe 30 minutes, to clear my head and to try to come back looking like a little bit less of a crazy person. And when I do, one of the relatives has given the one pill that I said my mom shouldn't get a second dose of. Privileges revoked. That night, I fire the one nurse's aide that I finally agree to get because she wakes me during the first solid night's sleep that I've gotten in weeks, insisting that my mom needs pain medication because my mom won't sleep through the night. I fire her, A, because my mom is saying that she doesn't need pain medication, and B, because this aide clearly doesn't realize we're not at that point yet. And so, instead of being paired, I'm surprised the next morning when I put a washcloth on my mom's chest and I tell her to relax, and she listens and just relaxes forever. When I go back to work a couple of months later, everything looks the same and everything smells the same. This weird combination of skunky anti-rejection beds and bleach wipes, and all the beds are in the same place, but I'm different. And of course, the first patient that they assign me as my primary patient ends up needing end-of-life care. And she's difficult to get a steady team of nurses together for because taking care of her is hard. It's hard for them to see her like this when they've known her to be so much healthier, especially when this girl and her family refuse to acknowledge that she's dying. I mean, this kid is on enough pain medication to fell a horse, and yet she's wide awake and talking about how she's going to ride one through the Grand Canyon as soon as she gets out of this place. And it's hard for me to take care of her because recent events would imply that I really suck at dealing with this part appropriately. So I asked her what trail she's going to take. And we talk about, what would be the best time of day to watch the colors move across the rocks. And of course I make sure her pain is in as much control as I possibly can, but I also jump right in when she goes on a tangent about how she's going to cover her room with hand-cut snowflakes if she can just make it to Christmas. Yeah, I realize I probably am indulging her fantasies instead of moving her towards the reality of the situation, but in the broader scheme of things, it doesn't really matter. Just like my stupid med calendar didn't matter. Or drawing a line in the sand over that one dose of morphine doesn't matter. Or almost assaulting a perfectly nice surgeon just because he insisted that my mom's liver was failing, when if you look at any picture of her from that time period, it clearly was. It doesn't matter. Not from a medical standpoint anyway. But it matters to us. To those families. Because when you get to a point where you're waiting for a result, or the treatment stopped working, or you've been in the hospital for so long that you forget what day it is, it's easier, it's better to focus on the stuff that doesn't matter because you sure as hell can't control the stuff that does. As a nurse, I've postponed a platelet transfusion so it doesn't interfere with the tea party. As a daughter, I've given my mom the margarita she wanted instead of the food she probably needed. You can't pay attention to everything all the time. So if you get deep enough into the stuff that doesn't matter, it can make cancer not matter. Not forever, but for a little bit, and that's something. Spoiler alert, my patient doesn't make it to Christmas. And she doesn't ride a horse through the Grand Canyon. But instead of being frustrated that she never accepted what her situation was, I'm proud of her and her family for never once admitting that her particular exit was okay, because it's not okay. That kid went down